Thank you, and welcome to Medicare 2021. I'm Matt Santelli, the Education and Outreach Specialist at the Pierce County Aging and Disabilities Resource Center. And we're going to be going over some of the basics as we head into the calendar year of 2021 with regards to Medicare changes as well as Medicare open enrollment. And the important thing is to not get bogged down in some of the numbers that you'll see. And remember that at the end of the slide, we'll have some resources that you can contact to help guide you if you have any questions. So we'll talk about that a little bit more as we go through. So before we get started, I need to give a disclaimer that the information provided during this presentation is not intended to serve as an exhaustive list of benefits available through Medicare coverage or Medicare open enrollment. Benefit availability always depends upon medical necessity as determined by a physician. So clients who are enrolled with original Medicare, Medicare Advantage, or Medicare Part D should always consult their plan benefit booklet, and we'll talk a little bit more about that, and speak to their plan customer service representatives for more information. So one thing I'd like to highlight is the Medicare and You book that my father received in his post office box about a week ago. And it's going to say Medicare and You 2021. It's going to say that's the official U.S. government Medicare handbook. That comes out every year around this time. And I really want you to think about that as a resource because it has a lot of good information that I'll highlight on specific page numbers that can really help you guide you through benefits in Medicare open enrollment. It's also available online, but the handbook's pretty handy to have because it's really become a more user-friendly guide over the years. So what are we looking at in terms of changes to Medicare enrollment because of the virus spread? Well, the most important thing to know is that all of the local Social Security offices are closed for in-person meetings. And enrolling in Medicare A or B can be done online, over the phone, through the mail, or even over the fax. And that's all things that are new. And for any of you who have visited the Tacoma Social Security office, you know why it's closed. There's just no way to do proper social distancing in that office because it just gets too busy. So the online information or U.S. mail options can be found at socialsecurity.gov. The phone option, as always, is available, 1-800-772-1213. But keep in mind, you're going to probably be on hold for about an hour if you call. The last time I was on hold, I think an hour 15. So make sure your cell phone is fully charged when you call them. Medicare information, including the plan finder, which we'll talk about a little bit, is at medicare.gov. And the phone option for Medicare, 1-800-633-4227. And again, you'll probably have an hour-long hold time if you call this time of year. So regarding the virus spread, COVID-19 virus spread, some of the things that Medicare has changed is really an improvement in terms of limiting virus spread. So office physician visits, for example, are now authorized to take place by computer, by phone, or through email. And it was already trending in that direction, but it's really exploded. I think I read that 60% of physician contacts over the last 6 months have not been in the office. It's been by other means. Home delivery of prescription medications more widely available either through delivery services or U.S. mail. Private hospital rooms are more widely authorized. And by that I mean if you're in the hospital and there's a virus spread concern, you're more likely to be approved to be in a private room. Now, many of our local hospitals are already moving in that direction, but this is pretty much across the board. Private hospital rooms in order to avoid virus spread. Also, and something very important for us as professionals, is that hospital patients are now authorized to transfer to skilled nursing facilities for rehabilitation even before they spend 3 overnights admitted to the hospital. So the general rule on skilled nursing facility Medicare benefits is that you have to be 3 overnights admitted to a hospital before your benefit starts so they can transfer you to skilled nursing. That's been waived during the virus spread, and that means that potentially after 1 overnight, if you're stable but still need rehabilitation, they can transfer you. And it was moving in this direction with some piloted projects, but now it's an across-the-board approval. So the reason they're doing that is to, again, limit virus spread. Why stay in a hospital for 3 days if you can transfer within 1 or 2 days? A wide variety of COVID-19 tests are now covered by Medicare Part B, including the drive-through tests, allowing you to stay in your car. So you drive through these testing centers, they swab your nose, you get results within a day or two. And all of those are covered by Medicare Part B at no cost to you, the recipient. So you don't have any out-of-pocket costs for those tests. And home health care is authorized for those diagnosed with or isolating at home due to exposure to the virus. So in past times, home health was only authorized if you were physically incapacitated from leaving the home. Now it's basically because you might be positive for the virus, or you might be immunocompromised and likely to catch the virus if you're out circulating. So why are all these changes in place? What prompted these changes to Medicare during the virus spread? Well, number one, they want seniors to stay at home but still have access to their health care providers by not having to do an office visit. Number two, easier access to prescription medications without leaving home through U.S. mail or home delivery. Three, allowing seniors to have home health services without as many visits from non-medical staff. So this question came up early on. We as case managers, for example, at the county, were told, stay at home, work from home, don't go out and see clients. Then people said, well, what about the care they need? Well, the caregiver agencies are still sending caregivers into the home, just like the home health agencies are. But the social work visit would probably happen over the phone, because that's a non-medical, non-care visit. That's a social work assessment. So those are the things. We're trying to limit the amount of time people spend in seniors' homes that might limit virus spread. Limiting the amount of times a senior needs to be in the hospital when a skilled nursing facility bed is a safe discharge placement for them. We just mentioned that. No need to stay 3 overnights if you're stable and can rehabilitate after 2 overnights in the hospital, for example. So that's a big change for the positive, because that really does clog up hospital beds when people who are stable are having to stay that 1 more overnight in order to activate their skilled nursing facility benefit. And that frees up hospital space for virus patients in need of care. And it also limits the spread of virus among residents of skilled nursing facilities, because the less time a patient's in the hospital, less likely they'll be exposed to the virus and they can transfer to skilled nursing facility quicker. Now, one of the downsides to all of that, and I've experienced that with my dad, is that Medicare early on said it's unsafe for folks to be visiting skilled nursing facility residents in the building. So we went for, I think, 3 or 4 months not seeing my dad at all. Not inside, not outside. We saw him a couple of times over a video link that the nursing staff provided. Only in the last couple of months were we able to visit my dad on the patio outside the dining room at his care facility. So that's been really one of the difficult things, that the skilled nursing facilities now, there's no activities going on, there's no salon services, no outside visitors, no communal dining, and it's really taken its toll on my dad. I could tell when I saw him that it's really been rough, because he's a very social man and likes to be out and about. They still let him circulate, but they kind of have to limit how much time he's doing that. So now let's talk about some basics on Medicare. Medicare is your health insurance coverage linked to your lifetime earned income or that of your spouse. Most people qualify at age 65. Others qualify for Medicare after having received their Social Security disability cash payment for 24 months. Now again, a lot of people don't understand that. I have a stroke or an injury or an illness, I can't work any longer, I apply for Social Security disability, hopefully I get approved. That cash grant sets your clock ticking 24 months before your Medicare coverage starts. Thankfully, with the Affordable Care Act, as professionals, we can get that person usually on some sort of health coverage, either through expanded Medicaid or one of the qualified health plans. But in years past, that's really been a problem, because we would generally have to get them on the state eligible health insurance, but that's only for even lower income people. So it's really a benefit that that 24-month gap period, we can now cover that to some degree. Initial eligibility for Medicare A or B, always completed by Social Security, so you have to call them generally as you approach your 65th birthday, unless you're already receiving early Social Security. Then they know about you, and they'll usually send you a notice saying your Medicare A and B card is coming. And again, people can defer Medicare Part B. Most people take Medicare A. You've got some flexibility on that depending if you or your spouse are actively working. We're not going to go into that today. You can always call our office or call Medicare for more information on that. And again, your Medicare card, it's a red, white, and blue card, has your name, effective dates of coverage for A and B, has an ID number on there, which is no longer a Social Security number, thank goodness. And again, let me emphasize that Medicare and You 2021 Handbook. It is a valuable resource. I really want people to start to learn how to use it. And I'll highlight some of the pages in there that are useful. But just page through it and you'll find it has a lot of good information. So we talked a little bit about different parts of Medicare. Medicare Part A, what does it cover? That's covering your inpatient hospital care. So you end up breaking a hip, your doctor says you need surgery, a hip replacement, you're scheduled, you go into the hospital, you spend 2-3 days there post-surgery. That's all going to be covered by your Medicare Part A, but there will be a deductible. The 2020 deductible is $1,408. That'll probably go up next year. And that's the first amount that you pay. Medicare pays everything after that. Then potentially with your Part A, you could transfer to a skilled nursing facility up to 20 days at no cost. There's a copay beyond that 20th day, but most people are able to rehabilitate in 3 weeks' time. Then Medicare Part B, as in boy, what does that cover? Anything out in the community, outpatient physician visits, lab work, diagnostic testing, specialty doctor visits and testing. It also covers some medications and medical supplies. One piece of good news is that in 2021, acupuncture will now be covered for 12 annual visits specifically to treat chronic lower back pain. So this is a long time coming that they've recognized any kind of alternative medicine with Medicare. So keep that in mind. If you've got chronic lower back pain, start talking to your doctor about whether acupuncture might be a good option for you, because this is brand new for next year. And again, with Medicare B, there's a deductible, there's premium, there's copay costs. The monthly premium cost was $144.60. That's probably going to go up from this year. The deductible was $198. That's also probably going to go up. And then you've got your Medicare Part C, known as Medicare Advantage, which we'll talk about more later, but that modifies your A, B, and D benefits under management of contracted insurance providers. There's usually premium, deductible, and copay costs. Some of them don't have a premium cost. And new for 2021 is that end-stage renal disease no longer prevents enrollment. So during open enrollment, October 15 to December 7th, if you join a Medicare Advantage plan or change Medicare Advantage plans or join a D plan or change D plans, it's all guaranteed issue, meaning they have to enroll you, but end-stage renal disease was one reason they could deny you, and now they can't deny that anymore. So that's a big deal, because people that are on dialysis generally incur some pretty high costs on original Medicare, and now those costs will be limited somewhat with Medicare Advantage. And then Medicare Part D, that covers your prescription drugs at community pharmacies, and with those plans, there's usually premium, deductible, and copay costs. So going back to the Medicare and You Handbook 2021, why do I think it's a useful resource? Well, number one, it's got really good information about original Medicare, Medicare Advantage, and prescription drug coverage. On pages 30 to 51, it has a comprehensive list of Medicare Part B covered services, including preventive services. And that's good to know, because your doctor has to know yours and your family history in order to properly manage your preventive services. So when they're looking at things like bone density screenings and aortic aneurysm screenings and things like this, they really need to know your family history to get you on the right schedule. So make sure, if you do an annual wellness visit with your doctor, make sure when they give you those questionnaires, you do think hard and fill those out accurately. Did I have a brother that died of a heart attack? Did I have a sister that had cancer? Did someone else in the family have a stroke or some sort of rupture where they had internal bleeding? These are the things they want to know. It also has an excellent side-by-side comparison of original Medicare versus Medicare Advantage on pages 6, 7, and 8. And then in the very back of the book, there's a complete list of all the local Medicare Advantage and Part D plans. That's pages 117 to 125. And that includes plan names, contact phone numbers, and basic plan benefits. So again, really want to emphasize, use that Medicare and You Handbook because it's got a lot of good information in it. So right now we are in Medicare open enrollment, October 15th to December 7th. And open enrollment is not relevant to what we just talked about on Medicare A and B. So your Medicare card that says you have A with an effective date and B with an effective date, that's a long-lasting coverage that's really not likely to change. So those effective dates stay the same. You're always going to keep your A and B. It's just the Advantage plans and the D plans where you have open enrollment options. And that's why the Advantage plans and D plans don't show up on your Medicare card, because your Medicare card is long-lasting coverage. Everybody can walk around with A and B. It's your option then if you want to do Medicare Advantage or a D plan during open enrollment. And just about everybody should at least have a D plan in place. The exceptions might be if you're still working and you have as good as coverage through work. Another exception might be if you have a veterans benefit where your prescription coverage goes to the VA. But for most people, you want to always have A coverage, B coverage, and D coverage if you're Social Security disabled or Social Security and now in retirement. So during this time, your changes that you decide to make, if you make any, will be active for January 1 of 2021. If you're on a D plan or an Advantage plan right now and you're saying, hey, it worked for me, I saw doctors this year, I saw specialists, I was able to fill prescriptions, then you don't need to make a change. Everything that's in place now will automatically renew. And we'll talk a little bit about what you want to think about if you are thinking about making a change. But in addition to your Medicare booklet, you should have gotten something from your plan around this same time of the year where it talks about your plan coverage going into next year. The good news is in 2021, there'll be 29 Part D plans available. This year there were 28. And for those people that are eligible for low-income subsidy, there's going to be 9 zero-cost plans. This year there were 8 zero-cost plans. So that's moving in the right direction. In addition, on the Medicare Advantage side, open enrollment for Medicare Part C and Part D is continued now. Those plans available in 2021 will be 50, including 24 with no monthly premium. There were 53 plans available in 2020, including 17 plans with no monthly premium. So again, as we move forward into 2021, those Advantage plans, there's a lot of them around, and a lot of them now are competing on that zero premium basis, where they really want you to join up because there's no monthly cost for the plan. Now remember, an Advantage plan is different than just a D plan because it does include health and drug coverage, meaning the plan manages your Medicare benefits for their enrollees and requires you as an enrolled person to see providers in their network. So the best way I can describe this is that think about Kaiser Group Health coverage. If you have original Medicare, you can sign up with the Kaiser Group Health Medicare Advantage plan during open enrollment. But into 2021, what does that mean? Well, that means you're going to get a card from Kaiser Group Health that says Kaiser Group Health Medicare Advantage Plan, and then your doctors are going to be their doctors. Your pharmacy is going to be their pharmacy. So if someone said, hey, that doctor down on the corner there in your neighborhood's a really good doctor, you can't go see him because he's not going to be part of that Kaiser network. So that's the starkest way I can describe it. Now, there's Humana coverage through Advantage Plan, there's Aetna, there's United Healthcare. They all have their own doctors' networks. So keep that in mind. You always want to verify doctors when you join an Advantage Plan. The other thing that an Advantage plan can do, which people see when they get advertisements from them or see it on the TV commercials, they can offer additional benefits beyond what Original Medicare offers. So Original Medicare has no routine dental, vision, or hearing, but a Medicare Advantage plan can offer you a few $100s of dental coverage per year. It can offer you a discount on hearing aids. It can also offer you routine vision exams or a pair of eyeglasses every couple years. Some of the plans offer health club memberships for free. Some of the plans offer free medical transportation to doctor's appointments. Some of the plans even offer grocery purchasing cards and over-the-counter medication purchasing cards. So they're allowed to do this because Medicare lets them add to the benefit. They can't subtract from the benefit, but they can add to it. So keep that in mind. If someone tells you, I got my free health club membership through my Medicare Advantage plan, that's true, and you're not going to get that through Original Medicare, but the trade-off is you go into their provider network and they manage your benefit within that network, so keep that in mind. So let's jump back to Medicare Part D, the basic benefit structure of Medicare Part D. This is your prescription drug coverage. There's many different plans available. The premium costs can vary. The deductibles can range from $0 up to $445 a year. If you have a deductible period with your D plan, that means you're paying all of the retail cost of the medication up to that deductible amount. After that, once your coverage starts in 2021 with your D plan, they have to pay at least 75% of the retail cost of the medication. Your copay cannot be more than 25%. Now remember, a generic cost is going to be much lower, so you might only pay $1 or $2 for a generic. A brand name can be much higher. You could see a brand name that retail costs at $500 a month or more. So 25% of that is going to be what, $200, something like that? So keep that in mind, or close to that, $125 I guess it would be. So keep that in mind, 25% of some of these brand names are going to be pretty high costs out of your pocket. Now, what used to be known as the coverage gap or donut hole was eliminated this year, meaning all year long you get at least 75% coverage of the cost of your medications. And then later there's a catastrophic period where that cost jumps to 95% that they have to cover. That's very far into the year if you have thousands of dollars of out-of-pocket costs. And then remember too, these D plans, just like your commercial plans at work, they can impose restrictions on those prescription fills. And by that I mean they could require that if there's a generic substitute, that instead of paying for the brand, they're going to pay for the generic. That's pretty much across the board. And the Surgeon General's office confirms that Medicare views a generic equivalent as good as a brand name. So if you've had a brand name and then tried the generic and haven't had the impacts you want, and the doctor agrees, then the doctor can always call the plan and say, hey, this person needs to be on the brand name. We've tried the generic, it didn't work. But keep in mind, then your copay is going to be for that brand name instead of the generic. They can do quantity limits. They could say the most you can fill each time is a 30-day supply of this medication. And that might be because it requires blood level monitoring. It might be because it's a controlled substance. It might be because it has some sort of addictive qualities, so they can put quantity limits on there. They can also do step therapy, saying, we need to try you on a medication that's less powerful before we try you on one that's more powerful. So an example of that is there's a cholesterol medication that I believe is an injectable for people with uncontrolled cholesterol. You're not going to get that injectable medication for cholesterol management unless you try the routine medications first. So that's step therapy. They're going to step you through the typical medications before they're going to approve you for something much more substantial. And then finally, doctor authorization. Some of them require the doctor to contact the plan and say, yes, this medication, it's usually ones that are very expensive, is the only one that we know is going to work for this client. So keep that in mind. A D plan, even with the coverage that you get, there can be some obstacles to getting prescriptions filled. Generally, the pharmacies know this right away when they try to fill for you, and they'll contact the doctor if they need to, or they'll contact the plan and explain the reason. So what are some considerations for keeping or changing your Part D prescription drug plan? So remember, premium, deductible, and copay costs can vary year to year. So if you've gotten your benefit booklet from your plan, like my dad got his from SilverScript, it had a side-by-side chart in there, what the 2020 costs were, what the 2021 costs are going to be. Premium's going to be the same. Deductible, I think, went up a little bit. The copay costs are going to be the same, so we're keeping it. There's no reason to change it. Also want to look and see, are you going to pay less if you use a preferred pharmacy? So many of the plans now are contracting with pharmacies, making them preferred, where you pay less, or making them just standard network, where you're going to pay more. So your favorite pharmacy may not be a preferred pharmacy. So there should be a list of those linked in the booklet online. The easiest way to figure this out, though, is bring your card to the pharmacy you normally use and say, hey, are you guys preferred with my D plan this year, and are you preferred next year? And some pharmacies go off and on with that year to year. And you can ask them what the difference might be. It's generally a difference of $2 or $3 per prescription filled. So if you have 10 prescriptions, it could be significant. If you have only a couple, it might not be. And then you want to verify that that plan's formulary, their catalog of medications, includes the one you're taking. So again, this is something you want to ask. Call the plan and say, okay, these are my 3 medications. This year you covered them. Are they on your catalog formulary for next year? So most of these questions are best handled by either talking to your pharmacist or calling the plan. And then finally, you want to ask if there's any injectable insulin discounts to limit copay costs. This is something new for 2021. It's known as the Senior Savings Model. So many of the insulins are very expensive because all the insulins that are injectable are still brand name. Now, some of them are mass-produced, so the brand designation isn't as meaningful anymore. But some of the ones that have been around a while are still very expensive. So for example, my wife takes an insulin that's known as Lantus. It's a long-acting insulin. Those injectable cartridges, a 30-day supply, retail cost can be as high as $450. So if you're paying 25% of $450, you're up around $110 out of pocket just for the insulin. So the plans that are participating in this senior savings model are going to cap that cost at a dollar amount. And I've seen the dollar amounts capped at anywhere from $25 to $35 out of pocket. Some of those are capping early in the year. Some are capping that if your expenses reach a certain level. So one thing you want to call your plan and ask, if you're on injectable insulin, you want to ask them, are you providing any copay discounts for my injectable insulin? And they should know that because locally, I think 10 different company names added this senior savings model. So it's important you ask about it because it can be a difference of hundreds of dollars over the course of the year. So those are the considerations for your Part D plan. Now, what if you're considering keeping or changing a Medicare Advantage plan? So again, the first discussion in your mind is, what's the premium next year? What's the deductible? What are the copay costs going to be, both for medications and for doctor visits? Because remember, Advantage plans cover your drug coverage and your doctor visits as well. Are my doctors going to be in the plan network next year? So again, this can change year to year. So you want to talk to your doctor's office and say, I've got United Healthcare Complete Plan 2. You've been in the network this year, everything's fine. Are you going to be in their network next year? Number 3, again, medications. Are they in the formulary catalog next year? Number 4, again, preferred pharmacy. Is your pharmacy preferred? Is it offering you less cost as a result? Are any of them close to your home? What if I want to do mail order? What are the options there? Is that going to save me some money? Generally, mail order saves you some money over going to the pharmacy. And again, number 5, any insulin discounts under the senior savings model. Are there injectable insulins you're taking that are going to be capped on the copay at some point during the year with the plan that you're choosing? So that's open enrollment for Advantage and D plans. We're going to now segue quickly to Medicare supplement plans, also known as Medigap plans. So Medicare supplement plans have nothing to do with open enrollment, and this confuses a lot of people. Open enrollment is for Advantage plans and D plans. So a Medicare supplement plan, also known as a Medigap plan, is not an Advantage plan. It's not a D plan. There is no open enrollment during the fall for it. It doesn't include prescription drug coverage. It does not include a doctor network. It simply pays the costs remaining after Medicare pays. That's it. So we talked about the deductible and copays for Medicare, original Medicare, Part A, Part B. Medicare supplement plans can pay for that, depending upon what category of plan you get. And the premium costs can vary widely. The plan my dad has, a United Healthcare Plan F, I think it's $170 a month. Some plans are twice that cost, okay? And again, these are supplements. All they do is pay second after Medicare pays. And they can require that you complete a health screening to report any pre-existing conditions, which can result in a denied application. So I just want you to know the difference, supplement versus advantage plan. And if you're considering buying a supplement, that's great, but you kind of need to know what the limitations are, and we have resources at the end of this presentation where you can call and get questions answered on that. So back to open enrollment. How do I change? What if I want to make a change from my D plan for next year, or my Advantage plan, or switch D to Advantage or Advantage to D for 2021 during open enrollment? So again, if you're happy with your plan this year, it's going to renew automatically. You don't have to do anything. But let's say you want to make a change. Well, the first thing you want to do, you can call Medicare, 1-800-633-4227. Tell them who you are. They're going to ask you to identify yourself with your Social Security or Medicare number, and then you can tell them, I want to switch from my United Healthcare plan to an Aetna plan. And they'll do it all for you electronically. Your new plan will take effect 2021. Your old plan will terminate at the end of this year. And you'll get a notice from that plan saying, Medicare notified us, our plan is terminating. You'll get a welcome packet from the new plan. Or you can go on Medicare.gov and use the plan finder. You can research plans on there if you're comfortable doing that. On the Medicare.gov homepage, you click on Preview 2021 Health and Drug Plans, and then in the middle of the next page, Continue without logging in. That's going to bring you to a series of questions. You're just going to click on what you're trying to do, whether you're looking at Advantage or D plans. It's going to lead you through screen to screen. You're going to add your medications. You're going to add your preferred pharmacy, and at the very end, it'll give you the top 3 choices for you. And that's a general search. You're just checking it based upon what your medication and pharmacy needs are. It's not going to ask you to load in any personal information. It's just a general search. Or you can call the Statewide Health Insurance Benefits Advisors, known as SHIBA, S-H-I-B-A. They have trained folks on staff. If you give them your medications, the pharmacy you want, tell them what doctors you're seeing, they'll go ahead and do this printout for you and send it to you. And then, like I said, once you make that change, once someone has entered to Medicare that you're making a change, your old plan will get knocked out, your new plan will start. This is only if you're making a change. If you're staying with what you got, it's going to stay there, automatically renewing into 2021. Now, I want to touch briefly on the combination of the two things. We started with virus changes to Medicare coverage, then we segued to open enrollment. So what's the combination of the two? Well, number one, Advantage plans have to cover you without regard to it, whether it's an in-network or an out-of-network facility you need to go to at the same cost. They can't limit you going to a non-contracted facility based upon a gatekeeper saying yes or no. And the cost sharing is the same. And this is because if you're in an area where they immediately need to take you to a facility for care that's not in the Advantage plan network, they want to make sure there's flow. So they don't want you to be limited on choices, which could increase your opportunities to get sick from the virus. And ambulance usage rules have relaxed as well. There's much more non-emergency transport happening now if the physician orders it. So let me give you an example of that. My dad, a couple months ago, fell. He broke a bone in his back, kind of a stress fracture. They sent him back to the care facility. He had a follow-up orthopedic assessment so they could start physical therapy for him. They called me and said, he has an orthopedic appointment on this day. We are going to transport him under Medicare rules, medical transport from here, there, and back. They said you can be at the doctor's office with him if you'd like, but because of the virus spread rules, you can't drive him to the doctor's appointment. Now, in months past, they would say, hey, your dad has a doctor's appointment. You need to come drive him because we're not going to transport him. Now the rules on that have changed. So keep that in mind. So continuing with Medicare Part C and Medicare Part D changes due to COVID-19. On the prescription side, out-of-network pharmacies, have to provide prescription coverage for you. They can charge you more, but again, this is to limit virus spread. So say you live in Eatonville, the local pharmacy is not in the provider network. They still have to fill your prescriptions to avoid you having to drive into Graham to fill prescriptions. They can charge you more, but they have to allow you to use that pharmacy to fill your prescriptions. And you can ask for 90-day refills now. Now, before they were limiting that a bit. In some cases, the doctor might still have to approve that, but you can ask the doctor to write you a 90-day prescription, and they should fill that for you. And then what about the costs? We talked about premium costs, deductibles, all kinds of things. Well, Medicare savings programs through DSHS can save you on the Medicare Part B premium and potentially on deductibles and copays. There's Medicare Extra Help that can save you on the Part D premiums, deductibles, and copays. And then again, there's that senior savings model to save money on injectable insulins. So again, I don't want you guys to bog down on the numbers here. The Medicare savings programs, it's basically for lower income folks and lower resource folks. In other words, as a single or married person, your income has to be like in the $1,500 to $2,000 a month range. Your resources, single, have to be about $7,860, married about $11,800. So there's a lot of rules that go with that. Don't worry about remembering that. If you've got an idea that your income is in that range and your resources in terms of bank accounts are in that range, you can apply online at washingtonconnection.org or just call us, 798-4600. Our name's at the end of the presentation and our phone number. It's a lot easier for us to walk you through it. And then again, Medicare Part D Extra Help, that limits your premium, deductible, and copay cost on your Part D coverage. It's a little more generous than the savings program. A single person's income can go as high as $1,595 a month, married couple as high as $2,155, single person resource as high as $13,110, married couple resource as high as $26,160. This program is approved through Social Security, so you can go on socialsecurity.gov and apply for it, or call them and say, I want to apply for Medicare Part D Extra Help, also known as low income subsidy, and they'll do it for you right over the phone.
Cut. I need for you to back up just a little.
Sure.
Matt.
Was I moving forward?
Yeah.
Sorry.
Your head was getting chopped up.
Uh-oh, sorry. Should I redo any of these?
No,
Okay.
I think you're good.
Okay.
We'll just start where you left off.
Okay.
Okay.
Great. So yeah, so again, don't get bogged down in the numbers on that Medicare savings program and the Medicare Part D Extra Help. The important thing to know is that there are some ways for people that are low income and low resource, whether they're single or married people, to save money both on their Medicare Part B premium and copays and their Medicare Part D premiums, deductibles, and copays. And again, that senior savings model for insulin, injectable insulins, that's available to anyone who's in a D plan if the plan is involved in that. So make sure you ask about that. If you're on injectable insulin, make sure you ask your plan about any specific savings on capping the out-of-pocket costs for those injectable insulins in 2021. So finally, the last slide for more information, useful resources. So I work at the county's Aging and Disabilities Resource Center, 253-798-4600. Always give us a call, questions on any of these Medicare-related things. We're either going to get you some information that's useful for you, or if it's a person that's really struggling, they might end up talking to me, and I'll walk them through it. Or you can call Medicare, 1-800-633-4227, medicare.gov. If you've got a reliable family member, a son or daughter that can help walk you through this, or even a close friend, sibling who's gone through it, have them call Medicare with you and ask the right questions, or go on medicare.gov and do the plan finder. You can always call SHEBA, the State Health Insurance Benefits Advisors. They have a statewide number, 1-800-562-6900, but they also have a local office through South Sound Outreach at 253-212-3519. And they will actually run through a whole Medicare plan finder printout and send that to you in the mail. And it'll show you the best 3 choices on D plans and Advantage plans. And then we always encourage you, with that information, you call them yourself and say, okay, here's my medications, what are my costs going to be? You call that Advantage plan referral and say, here's my medications, Here's my pharmacies. Here's the doctors I see. Can you verify that all these things are accurate based upon what I'm seeing on the paper? And then finally, questions on initial Medicare eligibility and low-income subsidy extra help, Social Security, 1-800-772-1213, and socialsecurity.gov. So I'll close with Social Security. It looks like going into next year, the cost of living increase is going to be, I think, 1.3%. So that's $13 on $1,000 of Social Security income. However, and unfortunately, it looks like your Medicare B premium cost is going to go up as well. So some of that increase, hopefully not all of it, is going to get eaten up by that increase in the Medicare B premium. And then beyond that, keep in mind, there's no cold call solicitations that should be coming from Medicare Advantage plans, D plans, Social Security, Medicare, any of those things. If they need to communicate with you, they should be doing that through the U.S. mail. So people are getting these random phone calls about their Social Security accounts being locked out for various reasons. They're getting emails about Medicare Advantage plans and D plans, things like that. Count on what you get in the mail. The stuff you get in the mail, you're going to get a lot of advertising from competing plans because Medicare lets them have your information to market their plans to you. So it can often say something like, urgent Medicare information or Medicare response required. Don't worry about that. Go with the plan you got. Start there first. Look at that renewal booklet. Call the plan number on the back of your D or Advantage plan card. Ask the questions that I pointed out here. It's much easier to keep a plan, let it automatically renew, as long as you're comfortable, again, medications covered, preferred pharmacies locally available, your doctors are in the network. And then I would say, even if the premium cost is going to change by a few dollars, it's a lot easier than starting fresh with a new plan. So keep that in mind. To some degree, we're not always looking to search on price. If it's something very significant, like your doctor's dropping out of the network, or you've got an insulin that's no longer going to be covered, or your local pharmacy isn't preferred anymore, those are decision points definitely. But in general, if it's an acceptable plan, you've used it this year, you've had some out-of-pocket costs that are manageable, just verify those costs with the plan and let it renew. That's the easiest thing you can do. It's always an option to make changes and the resources are there, but doing a little bit of research can put your mind at rest that the plan is working for you next year, is going to work for you this year, is going to work for you next year as well. And thank you very much. Give us a call if you need any help. Appreciate you listening.